My name is Dougal Sim. I'm the lead physiotherapist here at Clinic MSK. It's quite a varied range, but predominantly it's looking after MSK musculoskeletal patients. So we see a range of patients that can range from professional, semi-professional footballers, athletes, to just Joe Public who's injured themselves at work or injured themselves undertaking a pastime. Could be playing rugby, could be playing football, could be falling off a horse. There's quite a mix of patients that we see. What we're trying to do here, and we're doing it first in the Highlands, I would imagine, is we're offering a diagnostic service, a treatment plan and a treatment service within 24 hours of referral is the aim. So working alongside Mr. Peter Grimes, who's our medical director here, he has a particular interest and expertise in sports injury, sports medicine. We can offer diagnostics such as ultrasound and more recently the MRI scanner. So it means we're a one-stop shop effectively. So you get your scan, you get a diagnosis, and on the back of that we can put together a treatment plan. And once we've got the treatment plan, we can implement the treatment if it's appropriate for us to do that here, or we might have to refer the patient on to another specialist elsewhere. But the aim beyond all of that is getting people back to work as soon as possible, back to their sport, hobby as soon as possible. Types of treatment that we can offer are first and foremost assessment, which is the basis of our formulating our treatment plan. In terms of treatments, we can offer hands-on soft tissue mobilisation, soft tissue massage. We've got electrotherapies such as shockwave therapy. We've got acupuncture, and we've got bespoke exercise programs for whatever the problem is for that particular patient. So we take them through specific exercises to strengthen muscles, to mobilise joints, to improve balance. Again, all tailored to what their particular needs are. The service is available to anybody and everybody who requires it. As I've said earlier on, that could be a professional sports person, athlete, footballer, rugby player, whatever, or it's just open to Joe Public who has got a particular ailment. We're seeing a mix of acute conditions, so that's where somebody would injure themselves, say, at the weekend in a particular sporting activity, and we hope to see them on the Monday to get them going with the treatment. Or it could be a patient with a more chronic long-term illness such as an arthritic hip or an arthritic knee. It may well be that they're waiting on surgery, a knee replacement, a hip replacement, so we can see them pre or post-operatively, and there's huge gains to be made post-op if we see them pre-op and we get them started on the appropriate exercise programme. All the evidence is that they will rehabilitate faster, quicker, better in the post-operative phase. The big advantage of coming to Clinic MSK is the waiting times. Waiting times for things like MRI, ultrasonics, orthopaedics, physiotherapy and the health service unfortunately are not great. But what we can offer therefore is speed. And the quicker we see somebody, the quicker we can make that diagnosis, the quicker we can set them on the right clinical pathway and get them seen by the right person at the right time in the right place. Now that might be us here, but it may well be a specialist somewhere else. But again, we will do what we feel is in the best interest of the patient to make sure that they're seen as quickly as possible and getting the right treatment in the right place. Just simply phone up the clinic and we will give you an appointment as soon as we can, and that's usually I'd say within a few days of receiving that telephone call. If it's for a scan, currently we're seeing patients again within a few days. I've just booked, I get a phone call this morning from a football manager and the patient will be getting their scan on Monday. So you won't get much quicker than that even going down south. And that again is a big advantage of the clinic here. This is the first open scan in Scotland at Clinic MSK, and a big advantage is that patients no longer have to travel to Glasgow, Edinburgh or Aberdeen for an MRI scan. they can get it here in Highlands.